Okay, Isabel, thank you for getting comfortable. Now that you are nice and settled, we will go ahead and get started with your head to toe examination this evening. So I am just going to start by getting a pair of gloves on. Give me just 1 second. Okay. Now, as we discussed, because this is an overall assessment of your basic bodily functions, I will not really be going in depth in any of these assessments today. I'm more so just having a basic overview of your scalp and your head and your abdomen, possibly having a look at your feet, just making sure there are no abnormalities there. And should you need any further assessment, I will be referring you out to a specialist for any of those needs, okay? Okay. So let's just start with kind of an overall assessment of your scalp. So I'm just going to start by using my hands to have a look at your hairline and a little bit of your hair follicle along the hairline, as well as the state of the hair itself. So you did say that you color treat your hair, which I can see. Now it doesn't look like it's been color processed from the root, so that will give me a better indication of the state of the hair that grows out of the follicle. So just kind of gently manipulating the hair to get a better feel for the strength and integrity of the hair shaft. So noting any breakage upon manipulation or any signs of damage or flaking. So checking to see if there are any signs of dandruff, which could produce either small or larger flakes. Also looking for any signs of possible psoriasis of the scalp, which typically manifests in larger pinkish to red patches, sometimes large white flakes, but they tend to be quite a bit larger than dandruff. So also not noting that. And of course, making sure that there are no signs or symptoms of infestation. So that could be anything from the basic head lice to something more sinister like mites, which we don't typically see in the head, but I have seen it on a few occasions. If you were someone who lived in like a wilderness area, then I would be looking for any signs of ticks. So far, I'm not seeing that, and you haven't complained about any tick-like symptoms or Lyme disease symptoms, so that's not something that I'm particularly worried about today. Also looking along the templar region for any signs of abnormal pattern baldness. Not something I would expect to see among many of my female patients, especially not in your age range, but it is something that I do want to go ahead and just have a look at. So far everything is looking fairly healthy, which is a good sign. So I'm going to go in with my Penlight, and this will just allow me to have a little bit of a closer look. So you just relax, try to keep your eyes closed. The light is fairly bright, so just using my light to assess the integrity of your skin. And so far not seeing anything abnormal. The hair follicle does appear to be intact throughout, and it is healthy. No notable damage here. We do have some signs of new growth along the hairline, which is completely normal, something we expect to see. Just an indication that your hair is growing continuously and that there are no signs of damage in your stages of growth, which is good. So just making a small part here and having a look at different sections of the scalp, noting any abnormalities, but I'm not seeing any so far. I do see several blonde pieces, and that's obviously from your alterations that you've made. So it does look like you have some blonder areas is that you've maybe had highlights processed, but it doesn't appear that that has affected your hair in a negative way, so that's good. And I did see in your chart that you stated that you wash your hair at least once a week, which is a good thing. I do encourage my patients to wash their hair at least every 7 days. And that will just allow for your hair to be cleansed, of course, as well as discourage any excess oil buildup or any clogging of your sebaceous gland. It also helps rid your scalp of any unnecessary bacteria. Of course, I don't want you washing your hair too frequently because that could lead to abnormally dry scalp, so that's also something to keep in mind. Now your hair does appear very well moisturized. It is shiny. There's a healthy sheen, not overly oily, which is a good sign. And just moving the shaft between my fingers in an effort to gain a better understanding of the hair health itself. So what I'm going to do is just take a few strands here, just have a little bit of a better look. So just looking at the length of the hair in its entirety, ensuring that there's no signs of excess breakage or weakening of the shaft. So that all does look great. And because you have color processed hair, what I'm going to do is take a piece of your naturally colored hair and a piece of the color processed hair, and I'm just going to compare them on a basic level, just looking at the structure and integrity of the two pieces, notating any differences that I might see. And then of course having a look at your ends, noting any split ends that I see, but that also looks okay. So that's a very good sign. So I'm just going to use my comb to perform a brief agitation of the scalp, and by that I mean just going to do a very, very gentle scratching of the scalp, notating any signs of flaking or dryness that I might see, which doesn't appear to be the case here. So definitely no signs of dandruff. Your hair appears well moisturized. And I don't think there's anything to be concerned about here, which is a great sign. Okay, so as far as I'm concerned, your hair and scalp are well within normal limits. There's nothing that I'm noting as a concern here. So what I'm going to do before we move on is just perform some palpations of your cranium. So essentially just using my hands to very gently apply circular pressure along your skull. And while doing this, I'm looking for any abnormal nodules or possible lumps or bumps. If you've injured yourself recently, then there might be a knot on your head or anything that I feel is outwardly abnormal. So if I feel any spaces that I shouldn't be feeling for your age group in between the different hemispheres of your scalp. So as a child, you do have openings in the skull that eventually close as you get older. So I would expect those to be closed. And if I do feel any gaps, then obviously that's something that we would want to look into further. So just looking for anything that could be concerning. Now, if any of this feels abnormal or uncomfortable, definitely if you feel any pain or discomfort, please let me know, because that might be an area that we want to look into a little bit more closely. So just gently feeling around here, manipulating the scalp slightly. Really not feeling anything though. Your head does feel very symmetrical and smooth, so likely not anything to be concerned about. The last thing I'm going to do for your scalp exam is just gently tug on the hair, and mainly tugging on the hair along the testing for follicular integrity and strength of the shaft, looking for any signs of abnormal breakage or weakening. Just doing a very gentle, even pressure, pulling slightly, and then releasing, and pulling again, and releasing. And I'm just going to do that one more time, Isabella. I'm going to pull here, and release. Okay. So all of that does appear to be healthy. So I am going to go ahead and move closer to you, and I'm going to start with an examination of your face. So I think what I'm going to do is tilt here just slightly so I can have a good look at your head. So perfect. Thank you so much. Just having a look at your face as a whole. So you are going to feel me manipulate certain areas with my hands, and you just relax. So I'm just going to start by having a visual inspection, and this angle allows me to look at your face as two halves. So essentially I am putting an invisible line down the center of your face and visualizing both hemispheres, looking for any signs of asymmetry or abnormality in the bone structure, anything that could indicate a possible sign of injury, possible atrophy. If you have muscle atrophy or wasting on one side, could be an indication of a stroke. If you have any drooping in any areas of your face. So just looking for symmetry here. Now, obviously not everyone's face is perfectly symmetrical, so I am just looking for kind of a baseline of symmetry here, which I am seeing. You have beautiful skin as well, so just having a look at the overall health and integrity of the skin, looking for any signs of excess skin damage or dryness. I am notating just a very slight dryness in the forehead. Cheeks are well perfused, nice healthy buccal fat here, no signs of wasting there. Having a look at the nose and the lips, specifically looking for well moisturization of the lips, which I am seeing. Your lips do not appear dry or cracked. Very good. So having a look at your lashes and your eyebrows, looking for healthy and even hair distribution there. Just going to gently tug down on your eyelids, just very gently. And having a look at the tear ducts. Okay, so all of that does look good. I'm going to go in with my Penlight. You're welcome to keep your eyes closed, whatever is more comfortable for you. I don't want to accidentally shine the light in your eyes. So I'm just going to start by having a look at your forehead. So as I stated, I do see a little bit of dryness in the forehead area, nothing too excessive. Okay, so having a look at the texture of the skin, noting any abnormalities or abnormal blemishes, specifically looking for any signs of melanoma, any abnormal moles. So I do see a small mole here, but it is round and symmetrical in shape. A light brown color does not appear to be anything of concern. I do see several freckles along your face, so it appears that at times you have possibly some unprotected sun exposure. So I would like to see you using a sunscreen, at least an SPF 50 at all times while you're outside. Even if it's cloudy, even if it's raining, you should be wearing sunscreen even in the winter. I know it's a little cumbersome, but it is very important. Okay. Continuing down the face, having a look at the eyelids, looking for any signs of twitching in the lid, any signs of abnormal puffiness. Good. Again, looking at the lashes and the brows, Now we do have very microscopic mites that live among our eyelashes, and they are not visible to the human eye, but I am just looking for any infestation that might be visible to me, which of course I'm not seeing here. So having a look at the bridge of the nose, shining my light in such a way that allows me to see any signs of deviation, which I'm not seeing. Bridge is midline. And of course having a look at the lips, which do appear very healthy and well hydrated, which is great. Alright, Isabel, your face looks very good, very healthy. So I'm just going to shine this light directly over your eyelids. Keep your eyes closed for me. And just looking for any signs of abnormality here. And looking for that light pinkish color as I bring the light closer. And here as well. Perfect. Also going to shine my light into your nose, and I should also see a cast shadow here, which I am seeing, as well as here, which I am seeing. So very good. No signs of concern there. Okay. So what I'm going to do now is move on to some manual palpations of your face. So I'm going to start by palpating gently around your jaw. So just using my fingers to very gently manipulate the skin around your jaw in such a manner that I can feel your teeth and your gum line. So just gently palpating here. And this is going to allow me to feel for any signs of dislocation or possible TMJ. So I'm just feeling around your jaw, around the mastoid process here. Good. I'm feeling healthy. Muscle strength there. So moving along to bottom of your jaw, feeling along your chin. Good. Very healthy bone structure. Okay. So what I'm going to do now is start up by your ear. And I'm going to be feeling along for your chain of nodes. So you have several chains of lymph nodes that run along your face. And if any of these are palpable, it could indicate a sign of inflammation in the body or possible infection. So just feeling around for anything that is more noticeable. Now this is an examination you can perform at home. It's not something that's really necessary unless you feel like you've been abnormally sick for a long period of time, possibly if you're susceptible to infection. So just feeling around here. All of that feels good. So I'm going to move down to the bottom of your jaw, feeling for your chain of nodes that lie along kind of underneath your tongue area, and not feeling anything there either, which is great. Perfect. Okay. So now I'm going to move my hands down and continue following down to the lymph nodes that you have in your neck. So just feeling around, seeing if any of that is palpable at all. Now you didn't say that you had been sick recently, so realistically I shouldn't feel anything here, but it's always good to check. Okay, so the last chain of nodes is along your clavicles, so I'm just going to follow that down, feeling for any signs of abnormality here. I don't think I'm feeling anything though. You appear to be in good health so far. Perfect, okay. Just going to place your hair back the way that you had it. Okay, so let's go ahead and move on with the next portion of your examination. What I'm going to be doing at this point is testing your reflexes. And I'm going to test this in several different ways. Now, not to alarm you, but I do have a couple objects here that are heavy and they are made of metal. Now they have been sterilized, so there's no need to worry about risk of infection, but I would like you to keep very still for me and try to relax your muscles as much as you can. So what I'm going to be doing is tapping along different portions of your face, and there's no reaction that I need you to give me physically. I'm just looking for your body's natural muscle reaction. So essentially just allow yourself to react as you feel. You naturally would here, okay? So going on with my first one, and I'm going to be testing your jaw. So I'd like you to just relax for me, stay very still. You're going to feel my fingers on your chin and then a very gentle tapping, okay? Should not cause you any pain. Just looking for a very specific reflex. Good. And a couple times here without my fingers. Perfect. That looks great. So I am going to do a very similar test with a different hammer. Now this one is a lot softer. It's made of a malleable rubber. So you're just going to feel me tapping along different portions of your face. Just relax. Again, I'm just testing your reflexes here, looking for a very natural reaction in your muscles, okay? Good. Also noting any audible differences that I might hear. So any of these areas don't sound similar, where they have similar bone structure. So for example, if there's an area that sounds more hollow along your forehead, might be something that we'd want to look into further. So just listening for any signs of abnormality here. Perfect. So I'm going to move on to testing along your eyebrows and just performing a very gentle percussion here. Please let me know if this causes you any pain. Okay. Move on to testing. Perfect. Great. I am seeing a very healthy reaction here. Good. And very gently testing the reflexes in your eyes. Perfect. Now keep your eyes closed for me. Very good. Very good. Perfect. Okay. Alright, you are doing so well. So along the lines of testing your reflexes, I am going to test for a couple different things in your face. So I'm going to go ahead and bring this over. And I'm just going to test for a couple of reflexes in your eyelids. So you just go ahead and relax. Just going to be pumping a small burst of air along your lash line. Okay. And I'm just looking for a very specific reaction in the muscles of your eyes. So just producing a small puff of air here. Very good. Very good, okay. Okay, so continuing on with that line of testing, I'm going to be using a very gentle, kind of feathery cotton wisp-like texture. And I'm going to be very gently manipulating the hair along your brows and lashes. This can be quite ticklish, I do apologize, but I'd like you to just remain relaxed for me if possible. So Very gentle sweeping of your eyebrows. Very gentle. Very good. Now going along your lash line. Very gentle sweeping of your lashes. Perfect reaction here. And again, very gentle sweeping of your lashes. And very healthy reaction in the eyelid. Okay, you're doing so well. So the next thing I'm going to do is perform what's called a sharp or dull test, or test for sensation. So testing the neurological components of your brain. And I'm just going to set this down. I have two variations of tools here. Now the first one is made of wood, and it has a very soft silicone cap on it. So this is what I would consider a dull sensation. Now the second one is a little primitive looking. It is made of metal, and it does have these kind of circular spikes on it, and this will just allow me to produce a very specific pain sensation. Now when I say pain, it's kind of relative, so it is meant to produce a very specific sensation on the skin. It will not, however, puncture your skin or make you bleed or cause any harm to you in any way. It is just very distinct in comparison to the dull. So what I'm going to do is just place these on your face in a randomized pattern, and I'd like you to indicate to me whether or not you feel sharp or dull, okay? So you just try to stay still for me, and you're going to feel these touch your face. And again, just indicate whether or not you feel sharp or dull. Now this is ruling out any possible neurological deficits, so this is a very important examination. But I don't want you to stress about it, okay? If we have any abnormalities, I'll send you to a specialist and we'll go from there, okay? And I'll start, and sharp or dull. Good. 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 Sharp or dull. Perfect, you're doing so well. And sharp or dull. Good job. Sharp, very good. Sharp, very good. That was dull, good job. Dull, good. Sharp or dull, good. Sharp. I apologize, that was dull. You did get that correct. Sharp, very good. And lastly, sharp or dull. Perfect. Okay. Alright, Isabel, so far you are flying through this test with no signs of concern. So you've done very well so far. And I would say that we can go ahead and move on to your abdominal assessment. So just for your peace of mind, I'm not seeing any signs of concern in your scalp or in your face. All functions seem to be intact. Your skin is well within normal limits. It does appear healthy. Well moisturized. I would maybe suggest using a little bit of a stronger moisturizer, something like a cold cream on your forehead. And of course, making sure that you're using SPF 50 every day while you're getting sun exposure, okay? Okay, so neurological functions are intact as far as your face is concerned. We are going to go ahead and move on to your abdominal assessment. So give me just a second while I get that set up and we will get started, okay? Okay. All right, Isabel. So So now that we have you all settled and ready for your abdominal assessment, we will go ahead and get started. So is it okay if I go ahead and pull back your sheet? Okay. So I'm just going to pull this back just enough to expose your abdominal cavity here, and just be folding this over a little bit. So similar to the examination of your face, we're performing a visual assessment and then we'll get started with the physical portion of your exam, okay? Just folding this over. Okay, so also going to be exposing your belly, so I'll just pull your shirt up a little bit if that's all right with you. And you're welcome to just relax your arms in whatever way is comfortable. Do you want to place this arm at your side? Yep, that's fine. Perfect. And I'll just go ahead and fold this over here so that just your abdominal cavity is exposed and very slightly pulling down your pants in an effort to expose the umbilicus here. So we can go ahead and get started with your assessment, and perfect. Okay, so let's begin by performing a bit of a visual assessment. So I'm just going to have a look at the overall integrity of your skin. So looking for any signs of abnormality in the skin texture, any signs of erythema, which would be like a pinkish red rash, sometimes blotchy but usually isolated, so not seeing any signs of that here. And skin appears clear, no signs of excess stretching of the skin or anything abnormal there. Also having a very brief look at the umbilicus to start looking for any signs of abnormality here in either shape or depth, which we will be measuring shortly. It does appear that you have a piercing, and it doesn't appear that this piercing is active, so you must have it closed for some time. Okay, so I'm going to start by having a look with my Penlight. So just beginning with a visual assessment, having a look with my Penlight, looking for any more obvious signs of abnormality that weren't noticeable to the naked eye. So having a look and notating any possible abnormalities, which I'm not seeing so far. The skin does appear very clear in texture, normal color variation throughout. Okay, so just having a bit of a closer look at the umbilicus here and noting any signs of abnormality in the piercing, mainly any scar tissue. So what I'm going to do is shine my light from one end of the piercing to the other, and I am seeing actually a fair amount of light. So that could indicate that your piercing is actually active. I know you said that it had been a while since you actually put a piercing in it, so I would be cautious before putting anything in there just to make sure that it is open, but it doesn't appear that it has fully closed, so just something to note. Okay, so let's go ahead and move on, and I'm going to be performing a couple palpations. So just like we did on the cranium, just using my hands to gently palpate around the abdomen here, okay? So you let me know if this causes you any pain. I'm going to start by palpating around your rib cage. And at first just doing a very gentle depth, not going in too far, just measuring around the ribs, looking for any signs of abnormality here. Good, as well on the other side. And of course, looking comparatively from one side to the other. Notating any differences in depth or anything that could indicate an abnormality in your rib health. So that does appear to be normal. Also going to just take a second to observe your breathing pattern. So looking at your breathing upon inhale and exhale, looking for any differences in depth from one side to the other, anything that could indicate an abnormality in your lung health. That does not appear to be present, so that's a good sign. So now just palpating along the mid-abdominal wall. These are your obliques. Very gently palpating down towards the umbilicus, feeling for any signs of hernia. So with strain or excess pressure, sometimes weightlifting or improper body mechanics, we can see hernias that tend to appear in this area towards the belly button. And I'm just palpating around to feel for any signs of abnormality there. So I do apologize if this is uncomfortable. I'm going to do a little bit of a deeper palpation, and this time I'm feeling around for your organs. Just feeling for any signs of inflammation in the organs. Also feeling your intestines, feeling for any signs of constipation or inactive bowels. And all of that does appear to be normal. Perfect. Okay. So what I'm going to do, Isabel, is go in with my stethoscope, and I'm just going to be having a listen to your abdomen, and this is just going to allow me to listen for any signs of abnormality that are not audible to my ear. So I do apologize, this instrument is very, very cold, so I'm just going to be placing this on your abdomen in various quadrants. And I'd like you to just relax and take some normal breaths for me. Okay. Very good. You're doing so well, just listening thoroughly, making sure I'm not missing anything. And now auscultating right above your intestinal wall. Listening to your bowel, and I am hearing active bowel sounds. It does also appear as if you've not eaten in the last few hours. Your stomach is growling, which is perfectly normal. Just going to listen directly above the umbilicus. Perfect, okay. All of that sounds completely healthy, so that is a very good sign of good gut health. So in just a second while I place my stethoscope back in the holder. Okay. So we're going to move on to a couple measurements of your abdomen and essentially just measuring for symmetry. So I apologize, this tool is very cold. This is just a measuring device that will allow me to assess for symmetry. So just adjusting slightly here. Perfect. Okay. So I'm just going to start by measuring the basic width of your rib cage. So starting here and following that down. expect this to be perfectly symmetrical, but I would like to see a base of symmetry. And so your belly button does appear symmetrical. Essentially just looking for symmetry among all sides and an even diameter. Okay, perfect. Okay. So of course at this point I am just going to perform a couple basic percussions of your abdominal wall. So you just relax. It's the same hammer that I used for your head exam. And just to start, I'm going to be percussing along your rib cage. Good. Perfect. Moving on to the lower quadrants. And directly over the umbilicus, listening for any obvious abnormalities here, which I'm not notating, so. All of that does appear to be intact. So what I'm going to do at this time is test your abdominal reflex. And I'm going to test this by placing different textures, temperatures, variations on your stomach. And you don't really have to do anything. I'm just looking for a very specific reaction in the muscles of your abdomen, okay? So to start, I'd like you to just relax for me. Keep your eyes closed. And you're going to feel an object on your skin. Very good. So just looking for that natural flexing of the abdominal muscles. Very good. Very healthy reaction there. Again. Very good. Good job. Okay. I'm going to repeat that test with a different object. Just keep your eyes closed for me. Good. Good. Perfect. Good job. Perfect. Great job. You're doing so well. I'm going to move on by performing a series of that same sharper dull test, this time using different tools. And you just relax for me and again indicate whether or not you feel sharp or dull. This time I will be providing you with an example because the variations are less distinct. So this is going to be our dull. And this is going to be our sharp. Okay, so you just indicate to me which you feel. Sharp or dull. Good. Sharp. Dull. Very good. Sharp or dull. and sharp or dull. Perfect, and sharp or dull. Good, you're doing very well. Sharp or dull. Perfect. Sharp, very good. Sharp, very good. Sharp or dull. Perfect, good job. And sharp or dull. Sharp or dull. Good. Sharp or dull. Dull, good. Sharp, very good. Sharp, very good. That was dull. Perfect. So I'm going to switch to a different object here. And this time you're going to feel dull or soft. And I'd like you to indicate to me whether or not you feel the soft or the dull. Okay, so dull, perfect, and dull, good. Soft, very good. Dull, good job. Soft, perfect. Dull, dull. Soft, good job. Dull, very good. Dull, dull. Soft, soft, soft. That was soft, very good. And softer dull. Perfect. Good job, Isabel. You are doing very well. Okay. So I believe that concludes our abdominal assessment with the exception of the measurement of your belly button. So what I'm going to do at this time is very gently place this object into the depth of your belly button, and then I'll be using my Penlight to just measure, and we're just getting a baseline measurement here, looking for any signs of abnormalities or abnormal depth that can indicate an injury to the base of your belly button, essentially, okay? So just relax for me. This test is a little bit ticklish, and I'm just going to go ahead and insert into the depth of your belly button here very gently. And when I hit resistance, I am going to lower my fingers down and remove. And then just using the measurement on my Penlight to indicate how deep we are. So I'm getting a measurement about 1.5 inches. And just as good measure, I'm going to do that one more time. So just relax for me, just very gently. Meeting resistance. And again, about 1.5 inches. So that's a good indication that there is a healthy depth. So nothing to worry about there. So that does conclude our abdominal assessment. So if it's all right with you, I would like to have a very brief look at the soles of your feet, just looking for any signs of muscle wasting. I will be testing your Babinski reflex and a couple other things that we'll go over, okay? Very brief, shouldn't take more than 5 or 10 minutes, okay? Perfect. So I will go ahead and cover you, reposition myself at the end of the bed, and we'll get started. Okay, thank you. Alright, Isabel, so I have you ready and in position for your foot exam. So just going to start by exposing your feet, and I do apologize, it is quite cold in the room. Just be exposing enough to have a look at the areas necessary here. So starting off with a brief visual inspection of your feet, and for the purposes of today's examination, I will mostly be looking at the plantar view of your feet or the soles of your feet. So just beginning by having a brief look, and just right off the bat, I do feel that your feet are very, very cold. So could be that it's because it's cold in the room, could also be a sign of poor circulation. So I'm just going to start by kind of feeling around and looking for any obvious signs of abnormality here. Now, you are fairly young and in good health, and you are not diabetic, so there's nothing I expect to see that is too concerning. So I'm just going to palpate bilaterally here. That way I can compare for any abnormalities between the two sides. So just palpating the toes. As well as the soles of the feet. Briefly visualizing in between the toes. Definitely not seeing any signs of excess callus on the bottom of the feet. Your skin is very smooth and appears well hydrated. Okay. So I'm going to perform a test to check for your capillary refill. So in order to do that, I'm just going to pinch gently on your toes and assess for how long it takes for blood flow to return to the area. So just gently applying pressure and then releasing. Good. Of course, performing the same examination on the other side. Okay. So capillary refill is within 2 seconds, which is what we would like to see. Now just performing a test to test for even temperature throughout the feet. Now, because your feet are cold in their entirety and not just at the toe, I'm not so much concerned about poor circulation. Generally, with poor circulation, we would see coldness more so at the toe, but you have it throughout your foot, so actually that is a good sign. Likely just due to the temperature outside as well as in the room. Okay. So I am going to go ahead and have a look with my ophthalmoscope, and essentially this is just going to allow me to have a bit of a closer look. So just going to look briefly at the soles of your feet and just looking for any signs of abnormality here, which I'm not seeing. Good, as well as on this side. And all of that does appear to be within normal limits. I don't believe I'm seeing anything abnormal here. Okay, very good. So nothing to worry about as far as your skin integrity. So let's go ahead and move on, and I'm just going to do a very brief test of the arch of your feet. So just using my ruler here. Okay, so this really will just allow me to measure for the arch of your feet and just measuring for symmetry essentially. So what I'm going to do is just place this on your feet and notating where your sole ends and where the arch of your foot ends, and comparing that to the other side. Okay, so I'm seeing fair symmetry here, nothing too abnormal. Also measuring the curvature of your toes in comparison to the measurements on my ruler. So typically the last 3 digits fall within this parameter, whereas the first 2 fall here, and that is perfectly aligned, so that's a very good sign. Performing the same examination on the other side. Okay, so seemingly nothing to worry about as far as symmetry, and you do not appear to have fallen arches or flat feet or anything concerning as far as that goes. I'm also not noting any hyperarch or overextended arches, and I am just going to flex your foot here and have a little bit of a better look there. Also going to flex the toes and just looking for mobility. Very good. Again, hyperextending here. And testing for mobility. Very good. Okay. You're doing well, Isabel. We are almost done with your foot exam. So I'm just going to perform a couple of percussions and very gently percussing on certain areas. Looking for healthy reaction in your reflexes here. Especially for that flexibility and natural bend of the toes, which I do see. Good. Very good. Okay. So what I'm going to do at this time is perform what's called a Babinski reflex. And essentially that's going to entail me placing this tool along the base of your foot, and ideally we would see a flex in the foot, which would indicate a healthy response to Babinski here. Okay, so I do apologize, this is very ticklish and it can kind of be uncomfortable for some people. I will try to make this brief, but it is an important test to rule out any signs of neurological deficit in the feet or in the brain. Okay, so starting at the heel. Very healthy reaction there. Good job. And moving on to this foot. And again, very healthy reaction to Babinski reflex there. So you're doing very well. I apologize. I know that's pretty ticklish. I am going to test that one more time, this time with a different tool, and this is testing for cold response to Babinski. So I'll have you just relax for me, and good. So mild reaction there, which is what we would expect. Perfect. Okay. So again, testing that on this side. Very good reaction here. Perfect. Okay, so you are doing great. And I'm going to just test for skin turgor in just a couple of places here. So what I'm going to do is flex the foot here and just use this tool to very gently pinch down at the excess skin of your foot. Good. Looking going for a base measurement here, making sure that there is not too much skin, but there's enough and that it is bilateral between the 2 feet, which I am seeing, so that is very good. And of course, the last portion of your foot exam is going to be a very, very brief test for your neurological response, so just testing sharp or dull. As I stated, this will be very brief, just making sure that those functions are intact, okay? So of course, just indicate to me whether or not you feel sharp or dull. Okay. Sharp or dull. Good. And sharp or dull. Very good. Sharp or dull. Good. Good. Sharp or dull. Perfect. Good job. And sharp or dull. Dull. Very good. Sharp or dull. That was sharp. Very good. Sharp or dull. Sharp. Dull. Dull. Sharp. Good job. And lastly, sharp or dull. Sharp. Okay, very good. All right, Isabel. Well, the good news is we have concluded your assessment, so your head to toe is complete. And as far as I'm concerned, all functions are intact. We've tested your scalp, your head, your face, your abdomen, as well as your feet. As I stated, this wasn't so much an in-depth assessment as it was an overall assessment of your bodily functions. I don't see a need to refer you to a specialist today. I would, however, like to see you back in approximately 12 months so we can reassess. Unless, of course, something were to happen and you feel like your functions are not performing adequately, then we would like to have you back and test you again. If you feel like at any point something is wrong or you happen to injure yourself, just be sure to give the office a call and we'll schedule you an appointment, okay? Okay, well, you did so well. I'll give you a second to gather yourself and I will see you next year. Thank you.